Imagine this. You're prescribed medication that is meant to improve your health, but instead, it slowly begins to affect your body in unexpected ways. You might feel dizzy, experience confusion, or even develop new health problems that were never there before. Could the very medications meant to help be causing harm instead? Many older adults rely on prescription and over-the-counter drugs to manage conditions like high blood pressure, arthritis, and diabetes. While these medications are often necessary, there are dangers that are not always talked about. Some drugs can increase the risk of falls, memory problems, and organ damage. Others may interact in ways that make them less effective or even dangerous. In this video, we will explore the risks hidden in common medications for older adults. We will break down the side effects, interactions, and long-term consequences that are often overlooked. If you or a loved one take any medication regularly, this is something you need to hear. If you haven't subscribed to the channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated with our latest content. Also, don't forget to like and share this video. Medications that can affect memory and thinking. One of the most concerning risks for older adults is the impact some medications have on memory and brain function. Many people assume that forgetfulness or confusion is a normal part of aging, but sometimes it is the medication that is to blame. Antihistamines are commonly found in allergy medications, sleep aids, and even some cold remedies. They work by blocking a chemical in the brain called acetylcholine, which is important for memory and learning. When acetylcholine levels are lowered, it can lead to difficulty focusing, short-term memory loss, and increased mental fog. Older adults taking these drugs may experience confusion, drowsiness, or trouble concentrating. Over time, this can create the false impression that cognitive decline is worsening when, in reality, it is the medication causing the issue. Medications for overactive bladder, such as those used to control frequent urination, can also interfere with brain function. They work in ways similar to antihistamines, reducing communication between nerves and muscles to help relax the bladder. However, this effect is not limited to the bladder. The same chemical signals affected by these medications also play a role in cognition, memory, and alertness. As a result, individuals taking these medications for an extended period may experience memory problems, slowed thinking, and an increased risk of developing dementia. Certain antidepressants and anxiety medications may also contribute to brain fog, drowsiness, or reduced concentration. Some drugs used for mood disorders work by altering brain chemicals responsible for communication between nerve cells. While these medications can be beneficial for managing anxiety and depression, some types may have a sedative effect, making a person feel mentally sluggish or detached. This can be particularly concerning for older adults who may already be experiencing mild cognitive changes. Medications that can increase the risk of falls. Falls are one of the biggest health risks for older adults, leading to broken bones, hospitalizations, and even loss of independence. Some medications make falls more likely by causing dizziness, low blood pressure, or muscle weakness. This is a serious issue, as falls in older adults can result in life-threatening injuries and long-term disability. Blood pressure medications, while essential for managing hypertension and reducing the risk of stroke and heart disease, can sometimes lower blood pressure too much. This can cause a sudden drop in blood pressure when standing up, leading to dizziness or lightheadedness. When this happens, an individual may feel weak or unsteady on their feet, making it much easier to lose balance and fall. For older adults, this is especially dangerous because their bones may be more fragile, increasing the likelihood of fractures. Sedatives and sleep medications are another major concern. Drugs prescribed to help with insomnia or anxiety often have a calming effect that extends beyond bedtime. Some of these medications can remain in the system for hours, leading to daytime drowsiness, poor coordination, and slower reaction times. When combined with an already decreased sense of balance in older adults, the risk of falling increases significantly. Pain medications, particularly opioids, can also contribute to falls. These drugs affect the central nervous system, reducing perception of pain, but also impairing alertness and coordination. Older adults taking opioids may feel groggy or disoriented, making it harder to walk steadily. This is why opioid use should always be closely monitored in older adults, with an emphasis on using the lowest effective dose for the shortest duration possible. Medications that can harm the kidneys and liver. The kidneys and liver are responsible for processing and removing drugs from the body. As people age, these organs may not work as efficiently, increasing the risk of damage. When medications accumulate in the body due to reduced kidney or liver function, they can cause toxic effects that lead to serious health complications. Non-steroidal anti-inflammatory drugs, often used for pain relief, can be particularly harsh on the kidneys. These medications work by reducing inflammation and pain, but they also reduce blood flow to the kidneys. Over time, this can lead to kidney damage, especially if taken in high doses or for an extended period. Older adults who already have reduced kidney function may be at greater risk of developing kidney failure if they rely on these medications frequently. Some antibiotics are also known to cause kidney problems. Certain types can be difficult for the kidneys to filter out, leading to a buildup of harmful substances in the body. If an older adult experiences swelling, changes in urination, or fatigue while taking antibiotics, this could be a sign of kidney stress or damage. Medications for cholesterol, while effective in managing heart health, can sometimes stress the liver. The liver is responsible for breaking down these drugs, and in some cases, prolonged use can lead to liver inflammation or damage. Symptoms such as nausea, abdominal pain, or yellowing of the skin and eyes may indicate liver problems caused by medication. Drug interactions that can be dangerous. Taking multiple medications increases the risk of harmful interactions. Some drugs can cancel each other out, while others may increase side effects. It is important for older adults to be aware of potential drug interactions to avoid serious complications. Blood thinners combined with pain relievers can lead to excessive bleeding. Blood thinners are prescribed to prevent clot formation, reducing the risk of heart attacks and strokes. However, when taken with certain pain relievers, the risk of internal bleeding increases, making minor injuries more dangerous. Diabetes medications taken with beta blockers can cause blood sugar levels to drop too low. This can result in dizziness, confusion, and even loss of consciousness. Individuals managing diabetes should be aware of this risk and monitor their blood sugar levels closely when using these medications together. Multiple medications that cause drowsiness can make a person overly sedated. This increases the risk of falls, accidents, and impaired cognitive function. Older adults should be cautious when taking multiple drugs that have sedative effects and discuss possible alternatives with their healthcare provider. What can you do? While medication risks exist, there are ways to protect yourself or a loved one. Reviewing medications regularly with a doctor can help determine if some drugs are no longer necessary or if a safer alternative is available. Being aware of side effects is important because new symptoms appearing after starting a medication should be discussed with a healthcare provider. Asking about lower doses can sometimes provide the same benefit with fewer risks. In some cases, changes in diet, exercise, or other habits may reduce the need for certain medications. The medications people take every day are meant to help, but they can sometimes do more harm than good. Understanding the risks is a first step in staying safe. Are there medications you or a loved one are taking that might have hidden dangers? If so, it may be time to take a closer look. If this video has helped you, then don't forget to hit that subscribe button and turn on the bell so you never miss life-changing health tips. Thank you for watching and see you in the next video.